So if you are watching us via YouTube, please make sure to subscribe. If you're not watching us via YouTube and you've missed any of our past events, then please know that you can go to our YouTube channel and watch all of these virtual open house events. We have all of the ones that we've done so far and so far on there. My name is Jasmine Alderson. I'm the spa director here at LUX A Medical Spa. Today we are being joined by Lisa Brown. She is a customer experience specialist from Hydrafacial. She is actually physically located in California today. So she's been with Hydrafacial for about 2 years. Of course, everything COVID related. They've done some restructuring in their business. So she is going to be joining us. It is her first time doing one of these events with us, so please help me make her feel comfortable and welcome, and show her, you know, our southern hospitality that we have going on here. Just so everyone knows, give you a little bit of a background about LUX A Medical Spa. Of course, LUX is co-owned by a plastic surgeon and a dermatologist. We've been open since 2014. Our board-certified dermatologist is Dr. Carmen Treywick. You may also know her from May River Dermatology. And our board-certified plastic surgeon is Dr. Frederick Winiger of Winiger Plastic Surgery. So we are the only medical spa in this area, and maybe even beyond, that is co-owned by both a plastic surgeon and a dermatologist. So we know skin. Our Hydrafacial procedures here in LUX are performed by estheticians and our nurse practitioner, Erin Hutchinson. We offer them both in our Hilton Head office, which is new. We've been open for about a year there, and our Bluffton office. We basically offer 2 types of Hydrafacial, and she'll get into the differences maybe a little bit, but we have a signature Hydrafacial, and then we have a boosted Hydrafacial. Basically what boosted means is that we do some of our boosted serums, and it gets, you know, you get better results, but it can also be targeted to the different things that you're looking for. At the end of this talk, make sure you stick around. We will be giving out a free signature Hydrafacial. Those are valued at $199. And then all week long, our Hydrafacials are 20% off. We're doing 20% off individual and 20% off our packages. So either make sure you're scheduled for this week, and if you're not scheduled for this week, you can give us a call and prepay for future treatments, or you can go onto our website, which is store.luxhhi.com, and shop them there, but I'll send you that link via chat. If you have any questions along the way, use the chat feature and we'll make sure to answer it. This is going to be super casual. We will make this whatever you want it to be, so please make sure you ask. And without holding us up anymore, I'll ask Lisa to join us on screen. And thank you so much for joining us today, Lisa.
Hello, everyone. It's wonderful to be here. Thank you for inviting me. One moment. So yes, like Jasmine said, I've been with Hydrafacial for a little over 2 years. I love the company, and Hydrafacial is for everyone. Not only do we do Hydrafacial for skin health, but we also have introduced CareVive, which is now for scalp health. It's 3 steps to the best skin of your life. For the boosters, we always want to include a booster. It enhances the treatment, what the client is going to see. It's going to boost their results. And so I say every face needs a boost. You can boost for hyperpigmentation, fine lines and wrinkles, and then we also have our clarifying, which is for the acne client. And I'm not sure if we have questions or.
Someone asked, what is the difference between a Hydrafacial and a regular facial?
So the signature Hydrafacial is just the 3 steps, 30 minutes, best skin of your life. When you go into a deluxe, that's where you're going to include that booster as well as the LED lights. So the LED lights with the red is for anti-aging, inflammation, and I just lost my train of thought, sorry. Inflammation and redness, sorry. And so the blue LED light is for, of course, our kill that P. acne bacteria under the skin. And if it is an acne client that has both, I like to use the red and the blue so we get rid of that inflammation, the redness, as well as killing that P. acne bacteria. And there's so many boosters that you can add to that deluxe treatment.
The questions are just starting to flow in now. So this is great. I love the question and answering part. Somebody asks, how often should you get treatments?
Should be once a month.
Wonderful. And someone says, hi, Lisa. Do you see results right away? And is there any recovery time?
0 recovery time. You're going to see results, of course, right after the treatment. You'll have that Hydrafacial glow that everyone loves, as well as seeing the gunky jar. After your treatment, your esthetician will show you the gunky jar and show you exactly what she pulled out of your skin, and that's pretty amazing.
Someone asks, I'd like to learn more about the serums used. She usually just does the signature facial. So just so you know, Lisa, basically what we do is we have our signature facial and then we have our boosted. And the boosted is where we might add in the Zoe or Dr. Nassif's or like all of those the growth factors and all of those types of boosting serums. So she'd like to learn the difference between some of those serums or the different ones that we have. And I think we have all of them.
Okay. Well, there are several. So we have Zeo, which is Zeo Bright Alive, which is for brightening. We have Zeo Rosatrol, which is for rosacea, but it also can be used on acnetic skin. There are the Hydrafacial boosters are Brightenol, which is a spot corrector for age spots, hyperpigmentation, and sunspots. And our Derma Builder is for fine lines and wrinkles, again, in the targeted areas. We have our new Regen Growth Factor, which is an all over the face. It's my go-to for everything. You're going to see results not only after the treatment, but 24 hours, and then again, even 48 hours after your treatment, you're going to see even better results. And that is with our 007, the way it penetrates into the skin on a deeper level is pretty amazing.
Someone says, what was the name of the serum you just referenced? I think maybe the new one, the new growth factor?
Correct. It's Regen GF, which is Regen, REGEN, and then GF for growth factor.
Wonderful. Someone wants to know, what does the treatment feel like?
It feels like you're having something done. Like it doesn't, it's completely painless. So there are 3 steps, unless you're including the booster, and then adding that booster in will give you those extra steps, but it just feels, let me see if I can. Just show you here is our Hydrafacial Magic Wand. And then we have the tips that go on. So if you can see this is the little vortex in there, excuse me, is what really gives Hydrafacial the edge, is the vortex in our tips. And so it just feels very, it just feels really good. You can tell that it's doing something, cleaning your skin, hydrating you at the same time. And it just feels, as you're going, you can just really feel that vortex on your skin. And just very refreshing.
someone would like to describe what those 3 steps are, and so I'm thinking like the cleansing, the exfoliating, to kind of go through what those steps are.
Oh, sure. So we cleanse and exfoliate, extract, peel and extract your skin, and then the 3rd step is with that Hydrafacial Liquid Gold with our Antiox Plus, which is going to give you that Hydrafacial glow and infuse that product into the skin. It's full of hyaluronic acid, peptides, and antioxidants. And so that's always the last step, to infuse and hydrate the skin.
These are really good questions. I love the question and answer, because it really gets, I mean, we could go on and on and on and
Right.
talk about everything about Hydrafacial, but knowing what people want to hear is,
Exactly.
And not knowing, oh, someone says this, and I absolutely agree with them. She said, just my own feedback, Hydrafacials have really been a game changer for me in my skin regimen. I absolutely agree. When we first got Hydrafacial, our doctors were like, well, what's the difference? What is it like? Why can't we just do regular facials? And then we tried them, and we now have 3 machines. So we have 2 machines in our Bluffton office and 1 machine in our Hilton Head office. So they really are, I absolutely agree with that patient. They really have been a game changer for so many people. And I have seen people who who do them on a monthly basis, and their just skin looks amazing.
Yes.
And I have even some people that do them a little bit more frequently than that. Sorry, somebody asked if we could call her to schedule an appointment, and so I'm typing to one of the girls to give her a call in a few minutes. So what other questions does everybody have? What would you like to? What brings you here today? Has everyone here had a Hydrafacial before? Yes. So somebody asks, and this is a better question for me. The $199 price that I quoted, is that for the facial with or without the boosters? How much are the boosters? Great question. So yes, the signature Hydrafacial is the $199. The boosted Hydrafacial is $299. Both are on special all month long. I'm sorry, well, yes, actually, between now and the end of the month, they're both on special. And it doesn't matter which booster you do. It's just the $299 is for the boosted Hydrafacial. So yeah, I guess what else? Tell us, Lisa. Like, sorry, now the questions come in. I have a questions, and then I've never had this type of facial. I have sensitive skin, partly because being on tretinoid cream. Yep, the tretinoin. Yep. Is this okay for sensitive skin? So can you talk to us about that, Lisa, and talk to us about what they should do pre and post care if they're using products like retinol?
Retinol, you need to be, if Accutane, it should be about a year before you have to be off the medication for about a year. And any retinols that are that strong, we want to make sure that we're off those for a couple months before, before you get a Hydrafacial treatment done, because it's extra exfoliating. And we don't want to.
But you mean a couple of days, not a couple of months, right?
Not with something that strong, with that retinol.
Well, yeah. Our office protocols with Accutane, which is the oral medication. Yeah, definitely longer time. But with like topical retinols, we usually say about 5 days.
5 days.
Mm-hmm.
Yeah, and just everybody's skin is different, so one person may be able to. So it's just the esthetician testing the skin and seeing how they react. So it's not really, it's really based on the individual.
Yes, absolutely. And we are offering the free virtual consultations with all of our estheticians and PAs and nurse practitioners for the rest of the month. So if you're not sure if Hydrafacials are right for you, definitely let us know, and we'll get you in before the end of the month virtually. Yeah, Lisa, what else? So if you were if we were doing this presentation live, what else would you want our audience to know about the Hydrafacial?
Just, yeah, don't get it until you get it, basically. Because once you get one, you'll never not be able to go without having them. And again, just when the esthetician finishes and shows you, it's the only treatment that you can really have done, and you see what was done, not only by the results, but by her showing you the gunky jar, and seeing what actually came out of your skin is pretty amazing. And like you said,
Yeah.
it is a game changer. Your skin will never be the same. And with each and every one, you just see better and better and better results.
Yeah, absolutely.
And it's great because it's, we can personalize not just every client, but every client's appointment time. When they come in, during the summer months, you might need that Bright Alive or Brightenol. And then in the winter months, you're going to need a different booster. And it's great because we can personalize for each and every time you come in for that Hydrafacial. It's very personalized to your skin for that appointment time, which I think is really important.
Next question. She says, is this good for blackheads and large pores?
Oh, it's amazing for blackheads. When you, if you're used to getting extractions, the extraction part on the Hydrafacial is not painful, and it really does do 110% better than manual extractions. You're going to see that in the gunky jar, when they show you what they pulled out of your skin, you're going to see it. And if you go on the Hydrafacial Facebook or anything, you'll see people post pictures all the time, or the Instagram of the nose and the blackheads before and after photos are pretty amazing.
They are. I agree. It's so, that jar, like you keep talking about, it's so nasty, but it's so fulfilling at the same time.
Exactly. It's so gratifying.
I know. You're like, ooh, that was in my skin. I don't even want to know. But she said, yay, I'm sold. I get extractions all the time, and they're terrible, and they are. And this is just such a gentler way of
yes,
of
and
clearing up.
It doesn't harm your skin.
Right. Now, and I should say that if we do have some patients who are dealing with like some acne, and on top of doing this, the girls do include like some manual extractions with it.
And again, that's personalization. So every single Hydrafacial treatment can be personalized every time you come in for your appointment, depending on what your needs are. I have clients, sometimes I have to do manual extractions a little bit, and then sometimes I don't have to, just depending on their skin at the time of the appointment.
Yeah, same with us, same in this office. I think we have patients, just kind of give you a general idea of the patients that, and I recognize some of the names, so those of you that I know or those people that get this done pretty frequently, feel free to unmute if you want to tell about your experience or send me a message. All of these are great, but they really do. I mean, their skin just glows all the time. You don't have to worry about getting it done right before an event, like what you were talking about. There's no true downtime. Now, I will say if you're extra sensitive, and you get it done, or you're concerned that anytime you get something done, you're red and you have something that same night, then I maybe wouldn't do it. But if you're not sensitive and not worried about that, then we almost recommend it, right? Because it gives you that
Right.
like red carpet glow.
Exactly. Mm-hmm.
Mhm. Or doing it like 2 or 3 days before a big event is a smart move too.
So I
Just
said,
make
like
sure
with
you
that
tell your
regen booster, you're going to see the best results 48 hours later. Anyway, so you can do it a couple days beforehand. Mm-hmm.
That's great. Yeah. I just tell people, always tell your esthetician what you have going on. So that way if they notice like, okay, their skin is getting red because I'm doing this, then I'll cut down on that step, or I'll change the booster to something
Mm-hmm.
else, or
And we can always just use the red LED lights, and that's really going to help
yeah.
calm the redness.
Yeah. So someone asked, can you also do it right before or right after? Can you do it right before Botox or fillers? So the answer is yes, you can. So you can do it the same day or before your Botox or fillers. In our office for Lux, they can do it after fillers, but it has to be at least 2 weeks after your filler.
Yeah.
So make sure you do it. If you wanted to do it, have it in the same day, we will schedule your Hydrafacial first. Great. Well, if anyone else has any additional questions, please continue to send them through. Here's my thing, is we can get you all the information you need, but these types of procedures are so personalized that I always say, if you want to know what's best for you, then the best thing you can do is schedule a consultation with one of our estheticians or our nurse practitioner, Erin. I recommend those because but really this is something that anyone can do it, and you don't have to know which booster you're doing ahead of time. So you don't have to sit here and figure out, oh, okay, which booster is best for me. They'll figure that out for you when you're in the room. And it may change from today's appointment to next month's appointment too. So I know that if you have been on these chats with us before, you've probably seen I pull up the little random spinning wheel thing and I put everybody's names in. I didn't have a chance to do that during this talk since it was so many questions and answer types of things. So what I'm going to do is I'm going to go through everybody who's joining us today, make sure everybody gets added in on my spinning wheel. I'll go back to our Facebook and Instagram pages and count everybody who liked and shared and commented, and I'll take a video of the spinning wheel. So come back to our Facebook page in just a few minutes and see if you won. I'll post it right on the event itself. And if no one has any additional questions, I won't hold anybody up, but thank you so much for joining us today. To the patient that said that they wanted an appointment later this week, I have Taylor giving you a call once we're done. So thank you so much, and they're saying thank you to you.
Oh,
so
thank you.
Thank you, Lisa, for
Great.
jumping
Thanks.
in on this. A little
Of course.
secret: Lisa didn't know she was going to have to do this, so she was filling in for someone who previously committed. So she did great.
Well, thank you.
And and these are fun. They're not the way that we would prefer to see you. Obviously, we would prefer to see you face to face. So we appreciate everybody for joining us and making this a fun conversation for us today. So we look forward to seeing everyone in the office soon. Thank you, and thank you again, Lisa. I really appreciate your
Thank
time
you, Jasmine,
and your
thank you,
knowledge.
everyone. Bye-bye.